Hi, Dr. Paul Feuerstein here, Technology Editor of Dentistry Today. I'm here today with Jim Ramey. Jim, how are you?
Doing well, thank you, Dr. Feuerstein.
Oh, very, very good. And we're at a company called DentiMax. DentiMax is a company that has dental software and a very, very nice digital radiography sensor. It's something I'm not 100% familiar with, so that's why I came here to talk to you a little bit.
Thank you.
It has an interesting name. What do you call this thing?
It's the Dream Sensor.
Dream Sensor. Wow. And what's my dream?
Well, the Dream was back before the CMOS sensors. There were CCD sensors with big, bulky boxes. The images weren't diagnostic. They were very uncomfortable, square corners.
Well, this is the original. I mean, this is the evolution of digital radiography.
It is, yes. And I dreamed about a sensor one day that was better than that, and now we found one that has it's the thinnest CMOS sensor on the market.
Wow.
It has rounded beveled corners for increased patient comfort.
More comfortable, right?
Yes, and it's also waterproof, so it's submersible in glutaraldehyde, so you can sterilize it.
So I can, as an essay, I can spray this with disinfectants without any problem?
It depends on the chemicals, but
right.
yes.
So it's not going to seep into the electronics.
Right.
That's pretty good. Mm-hmm. And so it's evolved, the sensors evolved over the years.
Yes.
And here we are, 2015, so do you have a new generation?
Yeah, there are some new things.
Okay.
There's a new protective plate that's made of a new polymer, a very thin, very strong, that helps prevent, when biting on the sensor, helps prevent delamination, which causes...
Patients don't bite on those sensors.
Yeah. And if someone drops it or hits it hard accidentally, it would help absorb that shock and prevent the module from being damaged.
I see. Now, one of the weak points I've always seen with the sensor is where the wire comes into the back of the system. How about that?
Yeah, we have a Kevlar reinforced cable right where the sensor goes in, so it's extra reinforcement. You can see it right on the sensor itself. There's this thicker area right here is inside there's Kevlar.
So that's bendable, but it's not going to fracture.
That's correct. You can bend it.
I do see the rounded corners also. It's very thin. Now, there's no box or anything. It goes direct.
No, it is a direct USB, so there's no box.
Now, is this a closed system or an open system?
We have an open platform imaging system.
Oh, terrific!
It works with virtually every system on every sensor on the market.
That's great.
Every digital sensor, every intraoral camera, every pan.
So there's no Twain drivers or things like that?
Twains work with everything, so we can use Twains, but we have native integrations with all of those products.
Wow. That's pretty impressive. Now, I know that there are certain times that awards come to certain products that I'm assuming, because I was told a little bit ahead of time, that something happened here.
Yeah, we received an excellent good rating from the clinician's review a few years back. Which is the same rating that some of the larger name sensors received, which was a pretty good one. And then we just recently received a 4.8 out of 5 from the product shopper in a clinical review as well, which is the highest score of any digital sensor has ever received.
That's
it's pretty cool.
Now, is this sold direct, or are you selling through dealers? How does that work?
We have both. We sell a lot direct. People can call us directly or go to our website, but we do have dealers around the country that can go to their practice and demo the sensor. We'll do demos online and remotely.
Really? Mm-hmm. Now, we don't have enough time now to go through a lot of details, but if a dentist wants more details on the whole system, is there a website? I assume there is.
Of course. It's www.dentimax.com,
That's simple
or you
enough.
can call us at 800-704-8494.
Boy. This is something interesting. I'm going to spend some more time when we finish this video and ask you some more questions. I'm very, very excited about this. Thanks so much. Hey.
You're very welcome.
Jim?
Thank you, Doctor.
Great.